Come in.
Hi, how are you?
Good.
My name's Brooke.
James.
I'm going to be your student nurse today. I'm from Stockton University. I'm just going to be asking you some questions and assessing your lungs and breathing. Okay?
Alright.
As we go, just let me know if you have any questions. Alright, so first, do you have any past medical or surgical history?
I cracked my head open when I was 3. Yeah, I had to get 21 stitches.
Okay. And what year was that? Was that like 2000?
2008 for me, yes.
Okay. Do you have any lasting scars from that?
Just a little bit right there. You might not be able to see it, but...
Okay. Anything else?
No.
No?
I think that's it.
Alright, do you have any family history between your siblings or your parents, including cancer, cardiac disease, hypertension, COPD?
My dad has hypertension, and my little brother has asthma.
Okay, anything else?
No.
No? Alright, do you take any medications, either prescription or over the counter? Any herbal
No.
remedies? No?
No.
Do you have any allergies to either drugs or anything else?
Not that I'm aware of.
No? Alright, do you smoke or have you ever smoked?
No.
Do you use alcohol or have you ever? Do you use any recreational drugs like marijuana, cocaine? No? What are your residency conditions? Where do you live?
I live with my parents.
Okay. Do you have a job?
No, I'm a high school student.
Okay. And what's your highest level of education? What grade are you in?
I'm a freshman right now.
Okay, great. Alright, do you have any cough or shortness of breath right now?
I have a small cough, but I think it could just be a cold.
Okay, what makes it better or worse?
Just like cough drops or like maybe some tea makes it feel a little better. And like when I wake up in the morning, it's usually pretty dry and hurts a little bit more.
Okay. And what's the quality of the cough? Is it just a dry cough or is it productive with mucus?
It's very dry. There's like, yeah.
Okay. And do you feel the cough anywhere besides your throat? Does it radiate through your chest or anything?
No, it's
No?
just my throat.
And how severe is your cough on a scale of 1 to 10? 1 being it's barely there, it's very dry. 10 being it's all the time, can't breathe, and it's probably productive.
Probably say like a 4.
4?
It's not that bad.
So is it bearable?
Yeah.
Yeah.
I guess I'll get through my day.
Okay, and when did the cough start?
A little over a week ago.
Okay, and you said you think it's from a cold? You might have a cold?
Yeah, probably.
Okay. Do you have any chest pain when breathing?
No.
No? Do you have any history of frequent respiratory infections or colds?
No.
Alright, how about a smoking history, asthma history, bronchitis, emphysema?
No.
Sleep apnea, bloody coughs, wheezing?
No.
None of them? Okay. Do you have history of lung cancer or TB? Family history?
No.
No? Have you ever had a TB screening, chest x-ray, pneumonia, or flu vaccine?
No.
No? Okay. Now we're going to move on to the physical assessment. I'm just going to use some hand sanitizer real quick. Alright, so first I'm just going to take your pulse, okay? Just take this wrist and put it up over here. And do it for 30 seconds. We have a respiratory rate of 16.
Is that normal?
Yes, that's normal.
Alright.
Okay, now I'm gonna have you turn to the side a little bit so that I can get to your back. Do you mind lifting your shirt?
No, that's fine.
Alright, so now we're just inspecting for any discoloration. Make sure that the spine is midline, which it is. There's no kyphosis, scoliosis, or lordosis. And you've never been diagnosed with any of these, right?
No.
Okay. And we're also going to check the transverse abdomen and the anterior posterior abdomen. The transverse abdomen should be about twice the size as the anterior posterior, which it is, which is great. That means there's no barrel chesting, so there's no COPD or anything like that. All right, now I'm just going to wipe off my stethoscope real quick before we auscultate. When I listen to your lungs, I'm going to be listening to 6 spots. Two being between your scapula, the other 2 being around the T10 level, and then 2 more in the axillary area, or just beneath the axillary area.
Alright.
Okay, so I'm gonna have you take a nice deep breath in through your nose and out through your mouth, okay? Again. 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 All right, now lift this arm, put it behind your head. Again. All right, and now the other side. All right, great. It's all vesicular sounds, which is perfect. You should only hear bronchofascicular up here in the trachea area. There's no adventitious sounds such as wheezing or rales or anything like that, which is great. Now we're going to check for egophony. So I'm going to listen to the same 6 spots, and when I put the stethoscope sound to listen, you're just going to say the letter E, okay? And it should sound clear. Okay, ready?
Yep. E.
Okay, again.
E.
Again.
E.
Again.
E.
All right, now lift this arm, put it above your head.
E.
And the other side.
E.
Okay, perfect. You have negative egophony, which means that there most likely isn't any fluid or anything in your lungs. So now we're gonna check for thoracic expansion. So to do that, I am just going to put my hands on your back and pinch a little skin between my thumbs. And when you inhale, then exhale, it should go right back to where they were. All right, so take a nice deep breath in and out. Perfect. It's symmetrical on both sides. So now we're gonna do percussion. So I'm just gonna go down both sides on either side of your spine. It should be resonance all the way through. Okay, it's resonant all the way through until you hit the diaphragm. Now I'm going to check for tactile fremitus. This is just vibrations on both of your lungs. It should be equal bilaterally. So when I put my hands down, I'm just going to be feeling for those vibrations, and you're going to say the number 99. Okay?
Alright. 99.
Again?
99.
Again?
99.
Again?
99.
Okay, perfect. So the vibrations are equal bilaterally. Now I'm going to do check for diaphragmatic excursion. This is just making sure that the distance your diaphragm moves is within normal limits, which is between 3 and 5 centimeters. between inhalation and exhalation.
Alright.
Okay? So first, I'm going to have you inhale and then exhale and hold it until I tell you to stop, okay?
Okay.
Ready? Alright, you can breathe normal. Okay. So I just made a mark where the sound turned from resonant to dull. The dull sound means I hit the diaphragm.
Alright.
Alright, so now I'm going to do the same thing, percussing down your back, resonant to dull, except you're going to inhale and hold it until I tell you to stop. Okay?
Okay.
Ready? Okay, you can breathe normal. Alright, so now I'm just going to measure the distance between those two marks. Okay, it is 3 centimeters, which is within the normal limits. Right, and then I'm just gonna wipe off those marks for you with an alcohol pad.
Alright.
Okay, great. Pull your shirt down. Alright, so that's the end of the physical exam. Everything seems normal. There doesn't seem to be any fluid or anything. And you don't seem to have difficulty breathing. It's just this small dry cough. So if you keep drinking tea, using lozenges, it should be better within a few days.
Alright.
Right, do you have any questions for me?
No.
Alright, thank you for coming. Let me know if you have any issues.
Okay, bye.
Alright.